So before I introduce our next speaker, I just want to reference Matti Apro, the past president of the European Cancer Organisation, has been very active with comments and questions, and we want to thank Matti for his comments. We hope to get to as many of them as possible, and I also want to really encourage as many people online as possible to keep submitting comments. We've got a panel discussion of an hour where we will have the chance to ask all the panellists our questions. But a colleague, the reason why I mentioned Matti is because my next speaker is Richard Price, who is also a colleague of Matti at the European Cancer Organisation. Originating from the UK, where he studied at the University of York in the north of England, Richard spent 5 years as Policy and Advocacy Officer at the European Association of Hospital Pharmacists, and he now is Head of Policy at the European Cancer Organisation. Richard, the stage is yours.
Thank you very much. Good to know my president's watching me. So I'm Richard Price, Head of Policy at the European Cancer Organisation. We're an umbrella federation of 40 different healthcare professional and other organisations, international and European, working together with 20 patient organisations who advise us closely. What we try to do, according to our mission about improving patient outcomes through multidisciplinarity, is we try to convey consensus to the relevant decision makers at the EU and elsewhere. And so on this topic, we're pleased to present, it's called an impulse presentation, and it's really in the context of the EU's new regulation on HTA, where to go next, what's the sort of spirit that should infuse that regulation. We're brought here together because of a good news problem. We wouldn't need an HTA regulation if we didn't have all of the innovation that's taking place, not only in medicines, but across the piece, whether it's in surgery or radiation therapy, information technology, AI, early detection, screening, and professional services. So solutions are required if health systems are going to be able to meet that challenge, and HTA is clearly part of that solution. And in the cancer community, we, alongside others in other health and therapeutic areas, do see a great need for greater EU cooperation in this area. It doesn't make sense to have widely divergent systems across the EU. There are efficiencies to make, and we can support the addressing of inequalities, such as we saw in the last presentation, through structured and systematic HTA cooperation across Europe. And so we were delighted when Europe's Beating Cancer Plan was published last year to see that sort of firm commitment that this was part of the solution. Having the regulation brought to its conclusion, it was a long period of time that it took to negotiate between member states, the European Parliament, and the Commission, what that regulation would consist of, what would be the compromises that needed to be made. But we were delighted by the end of last year to see at least something firmly on the statute books and now existing as a real legal tool. Of course, there are different opinions about what it will be able to achieve given the compromises that were made, but I think compromise is natural in EU policy making. I think if a camel is a horse designed by committee, then EU legislation is regulations designed by many committees. But I think there's a framework there, there's a spirit there that can be worked on. The task before all of us now is to make sure that this regulation is seen to be a success, that it achieves all that it can achieve. And I think that one of the sort of themes of what I want to set out is a regulation, of course, provides detail on what must be done. And in the EU's regulation, there's lots of information about the makeup of committees, how those committees will vote, etc. But it doesn't prescribe what may not be done. And I think that's really, how we have to start this regulation. It's what are we building from this, and where do we go over the longer term? What's it heading towards? And so the 4 points I want to get across from our perspective is making sure that sense of mission really is there in all of the work that takes place. We heard from the Commission earlier that the Member State Coordination Group is just getting going. It needs to set out its own structures within itself, and I think they need to infuse themselves with the broader purpose. Getting the governance right from the start, making sure that we build upon voluntary framework of cooperation and what could be included there, and making sure that there is a holistic vision to that. So what do we mean by these things? I think on what we're trying to achieve, that's not necessarily laid out in a great amount of detail in the regulation itself. But I think from stakeholders' point of view, we do want to see more efficient processes that work in a timely fashion, that speed up access to new innovations and improve outcomes ultimately for patients in the areas that matter to them. And therefore, when producing these joint clinical assessments, of course, that was a great debating point in the regulation about should they be mandatory in terms of their implementation. In the end, the regulation didn't make them mandatory, but that doesn't mean that they then should just become academic papers or things that are not referred to strongly. We think these should be ultimately taken up by countries, and that's going to require the willingness of the member states, but also the health community at large to be expecting that. And of course, those clinical assessments then, in order to get to that point, they must command the confidence of the healthcare community. So how can that take place? And that's around getting the governance right at the start. And I thought there were really excellent points raised by Antonella in her presentation, really thinking about how patients, for example, can be strongly involved in making sure that that's not just, as she mentioned, a tick box exercise, but something that's in all of the work that the new processes conduct. And I think there are some great good practices to adopt in this area. I think the European Medicines Agency has really set a bit of a gold standard for how patients and other stakeholders can be part of the meaningful conversations and decisions. And I know their independence has not been in any way compromised by having forums where patients and healthcare professionals and others are able to scrutinise documents and influence work plans, for example. I think then if you look at the regulation, as well as all of the things that are compulsory or mandated, there is quite a lot of description about voluntary cooperation, if you like, coalitions of the willing that could be generated on particular topics. There is also mention of, for example, annual work plans of the member state coordination group. So all of those things are open for member states to decide what they want to cooperate on, and we would certainly encourage that there be an ambition there. One of the areas, I'm just highlighting one, would be on patient-reported outcome measures and patient-reported experience measures. So those could be, we know that those are very, very helpful in sort of driving more thinking towards areas that don't perhaps get the attention they otherwise should, like, for example, pain intensity or side effects or patient safety. And but yet there is obstacles and barriers to the PROMS agenda being adopted more widely in European regulatory systems and in health systems. So perhaps, for example, the Member State Coordination Group could take voluntary initiatives here to assist that agenda. And finally, we think perhaps what we saw when the regulation had political difficulties in being agreed is perhaps that stems from a lack of shared vision about where we're trying to get to in the future. And I think that's something that could still be addressed. This regulation is not the end of the story by any manner of means. We need health technology assessment now. We need value-based healthcare future for the future in all areas of major innovation, not only in medicines. And so we think, again, this new era that we are embarking upon can be a sense for developing that long-term vision. Where do we want to be in terms of 20 years' time, the cooperation between EU member states on the topic of value-based healthcare. So thank you for your time. We do have some further thoughts in a report that we wrote not so long ago called Strengthening Europe in the Fight Against Cancer, and we're always very happy to work with other stakeholders on these shared agendas. Thank you.
Thank you.